Radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
Sometimes your body not feel so fine, head hanging low most of the time. Got that meat sack not doing good, head hanging low, don't feel like you should. I talk to the Carolyn. What? Talk to the Carolyn. Talk to the Carolyn. Talk to the Carolyn.
Welcome, everybody. We are live with Dr. Carolyn Dean here on achieveradio.com, or as I like to say, we are also living with Dr. Carolyn Dean here on achieveradio.com. Thanks, everybody, for tuning in, those who are in the United States and those who are around the world. I'm Ginny Gunther, also known as Ginny Almighty by my dearest and closest friends, and we're just so glad, again, that you're here tonight. Just like our good friend, Dawn in New Jersey, who types in tonight and says, I'm so happy to be here tonight to hear from Dr. Carolyn Dean. I love my products. It has not been easy, but I think it's working. And kudos to you, Dawn, for hanging in there. God bless your heart. And yes, you know, it has not been easy for Dr. Dean either. God bless Dr. Dean's heart. I mean, my gosh, this woman is just one of the most phenomenal women in the United States, in the world. I mean, she is probably going to win some kind of huge award like the Nobel Peace Prize or something. Who knows what she's going to get? She wins my award every single day for the woman that I admire the most. And it has not been easy for her either, because she has been on the leading edge of creation, out there dangling on the side of the universe with the skinny branches, you know, dust falling off below her feet into a huge vortex as she dances around this whole leading edge of natural health and nutrition and wellness and well-being and body, mind, and all these things that she's done all these years, being on the leading edge of the gut and understanding yeast and candida back in the 80s, on the leading edge of the emotional conflict of the mind and the body and how it manifests symptoms with total biology and her training there. And now she's on the leading edge of all the supplementation in the world with her formulas that are pico-ionic, able to go into the cells. And what has she gotten for it in return of being a huge, incredible leader, somebody who's highly valued and esteemed among her colleagues, including like Dr. Christiane Northrup, who's just said the most amazing things about her, and all the other doctors that she works with. My goodness gracious, is she has just been attacked and berated by her own community of doctors and by licensing boards and everything. And you know what? She does not care, people. She doesn't care. She just keeps going because you know what? She knows she's right. And you know how she knows she's right? Because she does it with her own body. She's not a hypocrite. She doesn't just tell people to do something and then toddle off to get, you know, special treatments and plastic surgery and wolf down a bunch of pills underneath her desk. I mean, she's doing this thing herself, and that's why she's so amazing, and that's why there's such integrity in the products. And yes, Dawn, you're right. You know what? Sometimes it's not easy, and I know Susie from New Zealand's listening, and Nancy up in Portland, and I mean Marcia in California, and everybody. You know, just love you, love that you're listening, and just totally grateful for you, but also very grateful for Dr. Dean tonight. The reason we're all here, before I bring her on, I just want to also say not only is Dr. Dean a medical doctor, but also a naturopath, an herbalist, an acupuncturist, a nutritionist, a lecturer, a consultant. And you know what? She's an incredible speaker. And she does a lot of health summits. She gives so much of her time so generously to all these people and their summits and getting the information and the word out and everything. And I never get weary of hearing her. I have done this show with her for almost, 5 or 6 years now. And every week it's great and it's new. And she always says something that's different. And I just love her to death. So everybody, welcome, Dr. Carolyn Dean.
Awesome, Jenny. Awesome. Thank you. Appreciate it. Yes, with my my fingers over the edge of the blade. The leading edge is really a sharp blade sometimes, but with Bob at my side, I've managed to prevail. And now with Ginny at my other side, I can't be beat. It's awesome. Thank you.
Oh, you're so welcome. So what good and wonderful things are we going to talk about tonight? So many things to talk about.
Well, you got the anxiety blog going, and we have a number of good mailbag questions. I don't even know if I did much of a blog. I'm getting into the time of year when I go around visiting the manufacturing plant, so I've been pretty busy getting ready for that. Actually, one blog I wrote, Alive and Vibrant at Any Age, this was an interesting summit, actually, that I did with a young woman this was the older woman who learned from her battle with cancer how to help other people. But she didn't know about magnesium, and now she's on the products, and she'll do just fine. So partly, Ginny, it's a whole new audience that I get when I do the summits, but the hosts end up learning so much. They're out there helping to consult with people and sharing their knowledge of what helped them in their health, but most of them don't even know about magnesium. So it's wonderful to bring the message further. And yes, the message does include products. I'm not apologetic about it anymore, because what's happened in the magnesium world and magnesium research is the researchers are still just using magnesium oxide. The most famous magnesium researchers in the world still tell me about the laxative effect they're getting from magnesium oxide. And, I send them bottles of Remag. I don't know if they use them. I'm not going to push it. But the concept of therapeutic magnesium has not reached the magnesium research community. You're the only folks that know about it. And that's why I'm so excited about talking about it all the time, because I know people can use the Remag and take enough that they can feel better. And when you take a horrific condition like anxiety and make a person feel better with just one simple mineral, it's fantastic. It's unheard of. Ginny wrote the blog. She probably cut and pasted from various things that she and I have written over the years. And I went to my new Magnesium Miracle Edition coming out mid-August, and I mentioned anxiety 84 times in the book. And an anxiety attack, I talk about it being an abrupt chemical imbalance in the body that produces intense fear or discomfort. It's a chemical. It can be a surge of adrenaline. It can be the hormones going a little bit out of whack. So while a panic attack can reach its peak within a few minutes, its combination of threatening symptoms and chemical afterburn can leave a person reeling for hours or even days. The most common symptoms include palpitations, pounding heart, accelerated heart rate, sweating, trembling or shaking, shortness of breath, feelings of choking or smothering, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, faint, chills or heat sensations, paresthesia, which is numbness or tingling sensation, derealization, feeling of unreality or depersonalization. We've had people on the show telling us about their depersonalization that went away under the Total Body Reset protocol. More symptoms: fear of losing control, fear of dying. So it's extreme. The symptoms are extreme, and when you go to your doctor in such a quote panic, then the doctor just wants to help and will give you a drug that is supposed to calm things down. But any of these drugs, if you look at the product label, they will tell you it's for short-term use only, especially the benzodiazepines, but people have been on them for years. The blog goes on, and you can see the blog at RNAreset.com under blog. Since many of the symptoms of panic disorder mimic those of heart disease, thyroid problems, breathing disorders, and other illnesses, people with panic disorders often make many visits to the emergency room or doctor's offices convinced they have a life-threatening issue. It's almost a panic disorder that sends people with atrial fibrillation to the doctor. Their pulse rate's elevated and their heart's beating erratically. So then, what we did, is it about a year ago, is I think Ginny and Chad convinced me to do an anxiety book. So it turned out to be a 100-page guide to identifying and addressing the symptoms of magnesium deficient anxiety. Comes with the protocol, 15 different testimonials, and this helps people, hear about other people's journey with their symptoms and how they overcame their symptoms. And it occurs because we're not getting magnesium in our diet. We're under so much stress. We've had a number of cases of women who, after their third or fourth pregnancy, they're so depleted. It's like the total body meltdown I talk about, and they're so low in magnesium. They're weak, and their heart just beats away either erratically or fast, and they just feel like there's something really wrong, and the fear of something being wrong just drives the symptoms even more. So with magnesium, I mean, you can go through the book, go through the anxiety book or magnesium miracle book and see how magnesium is going to be balancing brain neurotransmitters, balancing the adrenal glands, calming the muscular and nervous system. And when people say, well, how can one simple mineral do all this? What you have to remember is magnesium is affecting 700 to 800 different enzyme systems in the body, many of which have to do with keeping the body calm and keeping it in what we call homeostasis. The body wants to be in a homeostatic, balanced environment, so it does all it can to create that. And it can only create that if you give it the right building blocks, and the basic building blocks are the minerals, good protein, which you get in your restructure, and then the direction to build healthy, perfect cells, which is our RNA drops. And the realign, of course, to take out the trash. So what I'll do is jump into the questions. We got a number.
Hey, Carolyn?
Yeah, Bob.
Well, when can we just start saying remag and not magnesium?
I do it. I do that.
Well, not just this last minute.
Yes,
people,
yes. I said it right at the outset. It's okay, Bob.
Yeah, so we're allowed to say remag and not magnesium.
Yeah, we can.
Yeah, okay, good.
But then you get people on Amazon. You're talking about your products too much.
So what? You're right. So you're always right. So doesn't matter. They'll learn.
They'll learn. Yeah.
Yeah.
Okay. So Ginny, I'm going to ask you if you're okay with me going to the mailbag now.
Yep, I think that's great, Carolyn. Thank you.
Okay, good. Hello, my question is how to sleep when your anxiety symptoms are with you 24/7. I don't experience panic attacks, but I have pressure in my head. I have had all the blood tests possible, and it was deemed to be caused by anxiety. I also have stomach pains a lot, strange sensations in my vulva and pubic public bone area, so that must be pubic bone. They can burn and then suddenly become cold, along with an odd, occasional sharp pain in the vulva. I mentioned them to my gynecologist. She was puzzled. I'm also on Prilosec for severe acid reflux, found after a barium test. I don't know if the barium caused it or not. Maybe not. I've been experiencing a lot of reflux, but I know that since I'm 63, I could very well have low stomach acid, but that wasn't tested for, as mainstream doctors don't do that. Also, burning, itching, vulvar area, along with frequent urination. Went to urology, going to all the different specialists. And after doing a vaginal check, found to have some vaginal atrophy, so was put on estrogen cream. All of these conditions happened in a 2-month span, so I got very stressed out and anxious. I want to know what happened just before that 2-month span to cause this decline. I will be taking the Prilosec twice a day at 200 milligram dose for a few more weeks. I have had lots of distress taking it. I still get occasional reflux and my stomach burns a lot. Not thrilled to be taking the estrase cream. I started taking the Remag last week and now added Remite to my salted water, too. I'm hoping to see some results soon, as I also have cramping in my feet for quite a while. Anyway, I can cope fairly well during the day, but I'm getting very little sleep at night due to the symptoms. It's all very strange, she says, a lot of distress. Don't know what are anxiety and what are medical problems. So, I mean, what a number of you who are regular listeners probably realize that, yes, there's a lot of magnesium deficiency symptoms. I mean, her cramps. But, when you get neurological strange symptoms where the nerves are, get burning or then get cold, I mean, I think of Raynaud's syndrome where the blood vessels get tight and then relax and cause temperature changes in the extremities. I don't know if that's what's happening to this person, but it's all related to magnesium deficiency, the itching in the vulvar area, atrophy vaginally. I would be thinking of yeast overgrowth and the irritation from yeast, and then all the foggy brain symptoms that occur with yeast overgrowth. So we'd want to do a yeast questionnaire to see if the yeast treatment is going to be required. There seems to be a lot going on, but I would look at total body meltdown, needing a lot of magnesium to get her sleeping, and the Prilosec, I mean, that even in the black box warning has magnesium deficiency as one of the major side effects. So while she's trying to suppress whatever stomach acid is left there, with the Prilosec, it's making the magnesium deficiency worse. And acid reflux, if it's caused by kind of spasming around the stomach and diaphragms, that type of acid reflux is related to magnesium deficiency. And what happens when you do get burning in the stomach, that's not acid, like she's killing her acid with the Prilosec, yet still get burning in the stomach. Well, that's from an alkaline pH, small intestine contents, washing back into the stomach with kind of the vacuum that's left there by that drug. The food is still there. The body's trying to digest it. So the pancreatic enzymes and the alkaline fluids in the small intestine go back into the stomach to try to help out, but just make things worse. So total body reset and the yeast detox. And I'm going to stop here for a second. Ginny and I didn't coordinate what's going on with the yeast book. Do we have a ETA on the yeast book, Ginny?
Yes, it'll probably be once you complete your world tour.
Oh, okay.
Yeah, so not this next Monday, but the following Monday, which I think is June 26th, would be the day that it would be going out.
Okay, good to know. My world tour, June 26th. Thank you. Mm-hmm. Question from another reader listener. I've been on clonazepam for 15 years for anxiety. Now, you remember what I said? It's for short-term use only. 15 years is a long time. Also, I'm on an antidepressant. She didn't say which one, but if it's the common ones like Prozac or what's the other P one, they both have fluoride molecules which bind up magnesium and make it unavailable to the body. So, we've got these constant problems with the drug side effects that we try to overcome, and it is difficult because I'm just looking at Prozac and see what the other P antidepressant is. It's difficult because you want to take something to help your symptoms, and you don't want the side effects, but the drug industry is just going to give you drugs that do treat the side effects. So anyway, this woman is asking, how can I get started on MAG, and she must mean Remag, and off these medications safely? Well, that's all described in the anxiety booklet, thank goodness. So it's a matter, you stay on your meds and you slowly wean off, because clonazepam is a benzodiazepam drug, and it is highly addictive. I've got some notes on it here just from probably Wiki. It's sold under the name of Klonopin. And now it's used to prevent and treat seizures, panic disorders, movement disorder known as akathisia. I've never been able to pronounce that, but that's drug side effect, movement disorder. It's a tranquilizer of the benzodiazepine class. It is taken by mouth. It begins having an effect within an hour and lasts between 6 and 12 hours. Common side effects include sleeplessness, poor coordination, agitation. Long-term use may result in tolerance, dependence, and withdrawal symptoms if stopped abruptly. Dependence occurs in 1/3 of people who take clonazepam for longer than 4 weeks. So there's the setup, folks, with taking the benzodiazepines for panic disorders. So it's important to understand that you can't just stop this stuff. A lot of people have tried, and they do get a lot of withdrawal symptoms. So as I said in the anxiety book, Magnesium, Deficient Anxiety, free at rnareset.com under books, you'll read about how to slowly start taking the Remag. And basically you start with a 1/4 teaspoon in a 1/4 liter of sea salted water and sip it through the day, and then every few days you add another 1/4 teaspoon until you get to therapeutic doses, which may be 2 to 3 teaspoons. But as well, you're going to be looking at the other Total Body Reset formulas, because if you've been on the clonazepam and an antidepressant for a long time, then it's going to have repercussions on the rest of your body. You're going to be toxic. You're going to be low in your other minerals. But, the worst is over. You know now that you can build up your minerals, and if you have to do yeast detox, we have that information for you as well. Similar symptoms here. Someone, the title of her question to customer service is "Still Depressed." Hi, Dr. Dean. I've been taking Remag and Remite for 2.5 months regularly. I started it when weaning off Cymbalta. Now, what is Cymbalta? Is that just a sleeping medication, or is that also an antidepressant? Yeah. It's a selective serotonin and norepinephrine reuptake inhibitor antidepressant. So it's doing all kinds of things to your neurotransmitters. So it's let me just see if it's a fluoride drug. No, it's not. So that's one good thing. It's used for major depressive disorder, general anxiety disorder, fibromyalgia, and neuropathic pain. So it's a lot of women who've gotten themselves into total body meltdown. That includes severe muscle tension in the neck and shoulders and limbs. They'll be put on this Cymbalta drug. So she says, in previous attempts to get off this horrible drug, I would have to stay in bed with severe depression, not being able to function at all, especially the thought of having to do anything, including going into the next room to get something, would make me sick. Accompanied with this was a severe crime bouts and total distortion or distorted thinking that everyone thought I was crazy. But with taking your 2 products above, I was able to rise up and carry on my life to some extent. So I realized these are helping me in more ways than I could imagine. My query is that I'm still experiencing that dread of doing things feeling most always along with no energy. Now, dread of doing things, or I don't know if that's fear of impending doom, but it's kind of a doom-like thing, and that can be related to the yeast overgrowth. So I think that should be addressed as well. And basically, I get most people on a diet, a yeast-free diet, avoiding sugar, gluten, and dairy to see if that sort of cleans up the irritation from those, highly allergic foods. She says, I ordered the rest of the RNA Reset program last week, so that's great. That's what I would recommend. Only been on the complete program for 4 days. Do you have any advice or encouragement for me? Absolutely. You're definitely, the worst is over. You're on the right track. 2.5 months is really a short amount of time, and if you're already feeling better, then you can only get better and better. It's all downhill from here. You're on the ski slope going down. No more uphill climbing. I've read an abundance of your material, and that's exactly the next thing to advise, is just keep reading the material, listening to the radio shows, and that's where you get your reinforcement, and questions you don't even know you have will be answered as you're going through the material. She says, I've read an abundance of your material and know you are correct about everything, as well as how others have been helped by it. Please send some good thoughts and ideas my way tonight, if you will. Absolutely. Yes, the worst is over. The customer service folks are there to help if you have any amount of questions. We know the protocols work, and we just reinforce them with people. Another anxiety mailbag. I'd like to know how much Remag is safe for me to take to help with anxiety and palpitations. I'm keen to take enough to get the optimum effect, but wonder if you can take too much and if this can be dangerous. Now, what I say in my Remag book and probably in the anxiety book or the AFib book is magnesium is the safest nutrient you can take, because if you take too much, you will get the laxative effect. Now, some people are very toxic, very sensitive, have leaky gut and yeast and all the rest of it, can get the laxative effect with Remag. They can get a little bit of laxative effect. We tell people they need more fiber. You have to support your bowel function and slow down your bowel function with more fiber, and usually we're just recommending psyllium seed. But there's no danger to having a little bit of diarrhea with the Remag as you're beginning the protocol. It is a safety valve, and in terms of the amounts, I mean, it depends. I'm not a big person, but I needed 4 teaspoons a day. That's 1,200 milligrams. 300 milligrams per teaspoon, and that was for my heart palpitations and leg cramps. And now, actually, I've been bragging about being down to 2 teaspoons for a while, and now I'm only taking 1 teaspoon a day. But I do take that throughout the day. I don't break it up. I'm sipping it, or I'd say more like gulping it about 5 times a day in my 20-ounce glass of water. That's how I'm doing my 1 teaspoon of Remag, and no symptoms. Now, when I start traveling, I'm doing my world tour starting tonight. I will take 2 teaspoons of Remag because of the stress of traveling. I think this comes off of away from the anxiety questions in the mailbag, so I'm going to go back to Ginny and see if we're ready to do the phone calls now.
Let me read a couple questions that came in through the chat line and things, and then we'll also announce phone calls at 602-666-6027. That's the number that you call if you want to talk to Dr. Dean. And then once you call, you've got to hit *5 on your keypad while you're listening to the radio show through the phone. You've got to hit *5 on the keypad to raise your hand and let me know you have a question or comment, and I will put you on the phone. And if you do that and I don't call on you, then type me a note in the chat line, because sometimes people's *5s don't work. Just type a note in the chat line and say, Ginny, I'm on hold, and tell me your area code, and I will put you on the line with Dr. Dean. Okay, let's see what people have to say. Let's go back here. Hi, this is from Starlin. Says, this is the first time on Achieve Radio. I just took my very first doses of Remag and Remite and Recalcia. Very excited. I have severe osteoporosis, and it's the most critical issue for me. I now have to get up the nerve to tell, I'm saying doctor, I guess his doctor, her doctor, that I am refusing Forteo. I hope she doesn't dump me. But I looked at Forteo, Carolyn, and it's like this osteoporosis injection that can cause cancer, for crying out loud. It's got this big, huge thing on their webpage that says, this causes cancer. Now, how could any doctor be upset if you tell them that you're not going to take that because you'd rather just not have cancer? Thank you very much, please. Mm-hmm. You know what I mean? Mm-hmm. Oh, my gosh. That's crazy.
Yeah, and they do say it's rare and all the rest of it. And what's interesting, I've read some papers on this business of how they'll list all their 200 side effects of each drug. And partly they list them all so they won't be sued if someone develops a rare something or other from the drug. They just, we told you. But at the same time, it scares the heck out of people. There's a balance here. I'd rather have the list so that I can just say to people, you can get one of any of these 200 side effects. So it's definitely it's up to you. And
Carolyn, I hope the lady gets fired from her doctor. The guy's an idiot. Find a better doctor. Just deal with Carolyn. She's your doctor.
No, I'm not.
Oh, yeah, that's right. I am. I'm the doctor.
That's right.
Yeah. Very good, Bob. Yeah. Step in and takes a bullet. That's very chivalrous of you.
Thank you, Ginny. Thank you.
Okay, let's go.
I don't know that much about Forteo, but I think it's new enough that we really don't know how bad it is, how bad the side effects are. And that's the trouble. There's this positive placebo effect of, this is a new drug, and we're going to let you have it, and you're going to get better. And, your body says, okay, great. And then, the side effects start coming out, and then you read about the side effects, and you're feeling the side effects. So it's this roller coaster when it comes to how the body reacts to these drugs.
Very good. Dawn from New Jersey said, a few weeks ago I had a setback. So with guidance from your support team, I started off very slowly with Remag. I am now up to 1 teaspoon of Remag and slowly working my way up to the therapeutic dose of 2 to 3 teaspoons. However, I added Remite, which I'm now up to a half a teaspoon. What is the ratio of Remag to Remite? When I put in my next order, I will also be ordering Recalcia.
Right. Well, because I want to keep iodine just at the RDA, I have the dose of Remite at 3/4 of a teaspoon once or twice a day. If someone is dealing with total body meltdown or thyroid, then they want the 1.5 teaspoons a day. So that's kind of the standard. The therapeutic dose of Remag is 2 to 3 teaspoons. And what I've realized is when people are on 3 teaspoons of Remag or more, they're probably going to need 2 teaspoons of Remite. So Remite is a little behind Remag because we don't want to push iodine or push any of the minerals. We just want to slowly build those up. But with Remag, it's doing thousands of things in the body, so we need as much of that as we can take, pretty much. So I'm back and forth, but this is where we really want people to work with us and with their own body and figure out what their own body wants, because there's no one size fits all.
Starlin typed in too, Carolyn, and said, I've used sea salt for years. Do I need to add it to my water? You answered that so beautifully last week on the show. And if you could say that again. And also, can I still add baking soda and apple cider vinegar to alkalize? Can I add lemon or orange oil for taste?
I'm not keen on the baking soda, because all you do when you take an alkaline baking soda and drink it into your stomach is you neutralize your stomach acid. And you want your stomach acid to digest your food. And although Remag doesn't need any acid in order to break it down to absorb it, you need acid in your stomach to break down other minerals and other nutrients in your food. And the bit about sea salt in water is that the minerals in the sea salt are in combination, like magnesium would be a magnesium chloride. And it's only in water that these minerals can dissolve, and they call it dissolution, where they break down into their ionic components. So you've got some little ions of magnesium, little ions of chloride, and it's when something broke in our house. It's when these ions are in their ionic state that they're absorbed in through the cells. So with the water, the sea salt minerals, they're breaking apart and coming together real fast, like infinitesimal timing. What makes Remag and Remite so incredibly special is they are stabilized in their ionic form so that they stay apart, stay as ions for longer periods of time, which allows them to be absorbed at the cellular level and have such great therapeutic effect. And we've heard this over and over again from people. Well, I tried magnesium years ago, it didn't work. And then, whoops-a-daisy, I tried Remag, and it was a whole different experience. Back to you, Ginny.
Very good. Excellent. Okay, let's go to recently my hormone test came back showing that I am now low in estradiol and estrogen. I regularly take Remag and Remite. I am 59. I thought minerals balance the hormones. Do you recommend more than the daily dose to avoid hormone replacement as in bioidenticals?
Well, minerals do a lot. They do help with the hormones, but hormones aren't made from minerals. They're made from cholesterol. They're made from the good fats. So there's a lot more going on. The bioidenticals, I don't really like them by mouth, and I've said many times that if people don't necessarily or shouldn't necessarily just go by blood tests because they're just so like a roller coaster. Blood tests or even saliva tests for hormones. You go by your symptoms. If a woman has vaginal atrophy, which makes intercourse painful, and or hot flashes that make sleep difficult and lots of hormonal sweating, then I recommend bioidentical estrone and a bit of estradiol and estriol in a vaginal cream combination. Maybe also progesterone in the mix, touch of testosterone if they require that. But it should be just a little, tip of the finger amount of vaginal cream that keeps the tissues healthy and is absorbed enough to help with hot flashes and sweats and sleep. So there.
And Carolyn, what about weight gain and, all the rest and low sex drive and all those other kinds of things? I mean, are those things that are symptoms, or are you just talking about the ones that you listed?
Well, weight gain, what was the other one you said?
Well, there's low sex drive, and there's also weight gain. These hair losses. These are all kinds of things that our customers kind of point out when they're where they're doing all this business. Yeah.
Okay. Well, the hair loss usually that's more related to thyroid, so that's where the Remite is going to support that. Low sex drive. That's where the testosterone aspect can come in. The weight gain. What's interesting, there can be, let's say, a 10-pound weight gain around menopause, and presumably it's to have a little extra fat on board to make, to get the cholesterol, to make the hormones. It's like your reserve. To try to create your hormones. So, I mean, I've mentioned that over the years, this little bit of weight reserve. But if it's more than that, then you're looking at thyroid, you're looking at lack of exercise, you're looking at, I'm too tired to exercise, and that's where the magnesium comes in. I'll pull all those symptoms back around to magnesium and the minerals and, maybe even the need for more protein. A lot of vegans and vegetarians, they can have a hard time with menopause because they're just protein deficient.
So this goes under the category of I always learn something new. So now I'm in my little own selfish zone over here asking you all these questions. But so cholesterol, like the kind of cholesterol that your brain's made from, type of a thing. Yeah. Really?
You need most of the cholesterol in the body comes from your diet.
And what kind of, like, if you were going to eat why don't they say, well, then eat this, and this food for hormones if it's coming from cholesterol? I mean, are there foods that you should eat?
Well, I don't know if customer service has my hormone balance book, but I talk about all. Yeah, I'll send it over then because I talk about all that in hormone balance. The flax seeds, for example, that's one of the phytoestrogens that will help the menopause symptoms. Phytoestrogen herbs.
We do get a lot of questions about hormone balance with women because we do have a lot of women customers, of course. And what we usually do is refer them to your 3-part interview on YouTube with CJ Liu. But if you would send me that book, that would be great, so we can cut and paste and share things with people who have that, interest or curiosity. Because no, we don't have that book.
Yeah, flax seeds, raw pumpkin seeds, red clover sprouts, and mung bean sprouts are the best ways to get phytoestrogens, and there are others. And the business of cholesterol, it requires a healthy liver to make hormones. So that's where that's where the Realign comes in, actually, and that's where the vegetarians actually are, guilty of eating too much fruit, which actually raises your triglycerides, and that throws off your liver. There's a component of fatty liver that happens with people who eat a lot of fruit, with women who have PCOS, polycystic ovarian syndrome, and with women who have yeast overgrowth. You can create so much alcohol and acetaldehyde in your body that it makes your liver think you're an alcoholic.
Really? Wow.
Yeah.
Okay, very good. Well, that's good information. Like I said, we don't have the book, so when I get it, I will be able to. We can do our little cut and pasting, and of course, get all that. All right. Let's go to the next questions here. 602-666-6027 is the number to call. So far, nobody is raising their hands, Carolyn. They're just totally engaged and enamored with everything that we're saying, listening away. Oh, there goes hands. Okay, hold on, Karen. I'll be right there. Let me just get this one question in, and then we'll go to, let's see, where is our caller from? Yep, New York. Hold on just one second. Okay, last year my doctor put me on a laboratory-grade glutathione after I had shoulder surgery and struggled with recovery due to the anesthesia. This is Dawn from New Jersey. Within 3 days, I had inner shakes. I developed anxiety, and I couldn't sleep. Approximately 2 to 3 months later, I started losing my hair. The doctor said my body was toxic, and it was responding, which led me to severe detox symptoms. Needless to say, I stopped it. I would like to try Realign, but I'm concerned about the ingredients, that it's a precursor to glutathione, and the fact that it detoxes the body. Is this something I should worry about happening again if I take Realign?
I doubt it, because it's like you're eating a food with methionine, and then the body decides if it wants to make it into glutathione. So it's not like a forced thing. But Dawn, was this intravenous glutathione that you were given? That's what I would need to know.
Okay, very good. Excellent. Okay, wonderful. All right, let's see. Let's go to our caller in New York. Again, area code 315. 315, you're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Yes, hi. This is Karen, and I wasn't prepared to actually raise my hand today, but since you didn't have anybody, I said, I'll raise my hand. So I did call about a month ago, and I'm not sure if you remember all this, but we talked about the yeast overgrowth. I went on the elimination. And subsequent to that, I actually found a doctor in my area that's an allopathic turned naturopathic. So it was a great combination. And he ran some blood work for me a couple weeks ago because the biggest problem that I've been having recently, I'm on all the formulas. About 2 months ago, I just started to have really sore throat and red lips. And when we spoke last time, that's where the whole yeast thing came up because I had thrush and everything in my mouth. So I've been on that protocol, and I do feel better having done that. But interestingly, the blood work came back, and I haven't spoke to him yet, but I did get a copy of it, and it looks like I have been my Epstein-Barr virus has been reactivated. My son had mono this past Christmas, and I never remember having it, although I realize that a lot of people have it. Most adults have it, and even though that they may not have presented with symptoms in their life. So not being able to actually read the blood work for sure, but it looks like I'm positive on 2 of the factors. There's 4 different factors, and it looks like it says something about reactivation. And so I guess my question is could this have been something from a detox standpoint from taking all the products that I don't know if you can rid your body of the virus at all, or, number one, is this possibly because I've been detoxing and kind of stirring things up and getting rid of some things? And second question, what would you suggest? Is there anything you would suggest beyond the formulas given that I have now been reinfected with Epstein-Barr, is there anything else that I should take?
When your son had mono at Christmas, did you get sick around the same time? Did you have a cold or flu symptoms?
Yeah, actually, he came home around December 18th with it already. He'd already have it for about a week to 10 days, symptom-wise anyways, at school. So he came back, and around probably the first or second week of January, both my husband and I actually got sick, but it just seemed like a regular cold. And then about a month after that, around Easter time, is when I started to have this like sore red throat. Lips were all swollen and red, and I didn't know if I was having a histamine reaction or not, but I think I'm putting that aside because I probably attributing it more to the Epstein-Barr.
Right.
So, yeah, that was the timing. He came home about a month later. We got sick, and then a month later after that is when I started having all these other symptoms, and I had, like, rashy red spots under my skin, not on top of my skin, but it was blotches underneath my skin.
Right. Yeah, I guess your doctor will know among the different antibodies. It will give the timing. If it's acute, if it's 3 to 6 months activation.
Okay.
I mean, to me, it sounds like you got reinfected, and we're very careful with the formulas about reactivating anything. Usually what happens if people go on these big liver detoxes or do a big detox, they can uncover viruses that are sequestered in the liver, but I make sure to not go there. I mean, the first work I did on infectious disease was working with AIDS in New York in the early 90s. And just like you said, everybody does have layers of viruses and infections, and they will come to the surface periodically, or they can be reactivated by another exposure. When you have Epstein-Barr, it doesn't mean that you'll never get it again like you do with some conditions. So, yeah, we've treated so many thousands of people with the formulas, and that's never really come up, that type of reaction.
I guess what I want to make sure I'm not doing is trying to say, the formulas did that, because one thing I will say is I had no idea it was the Epstein-Barr, because I'm a fitness instructor, and I have been exercising and, doing all my classes. Maybe I shouldn't have been, but I wasn't tired. That was the one thing I never felt. I never felt tired. I just had all these other weird, symptoms kind of around that, but I've never felt fatigued at all. So I guess, that might be because of the formulas, but is it, I read someplace too where there's a theory out there that you can actually rid your body of the virus, or is that not a true thought?
Well, it's, the antibodies are always going to show. I don't know if your doctor's going to try to do, polymerase chain reaction, PCR testing to check for live virus. I don't know if they do that in Epstein-Barr. They do it on HIV, but you can analyze DNA and RNA from the live bacteria or a virus to see if it's active now. I mean, it's just it could still be yeast that's in and around body that's being weakened by Epstein-Barr. I mean, this is everybody with chronic fatigue and AIDS that we tested in New York had Epstein-Barr, chlamydia, herpes. They had just the whole range of all the viruses. And yes, I do talk about the body operates in layers where it will kind of bring something to the surface to allow to be treated. But your question was, will it go away? I think we all have a little bit of virus and yeast in us, and I don't think it's possible to say, well, you'll eliminate it entirely, but your body will certainly cope with it. And it sounds like with your physical energy, etc., you've been able to maintain that. And that's what probably makes it difficult to diagnose, because it's not full-blown.
Oh, Carolyn, let me just interrupt. We've got to go to a station break, but you go ahead and stay on the line, Karen, and we'll wrap it up at the end of at the beginning of next hour. So this is Live with Dr. Carolyn Dean here on AchieveRadio.com. Short break, and we'll be right back. Everybody stay tuned.
We'll be back with Hour 2 of Live with Dr. Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
AchieveRadio.com. How can humans regenerate their bodies? How can they actually grow younger instead of older?
That you do it already. Eat, drink, eat anything, eat everything. Eat everything. Have no restrictions or any regard about anything. But here's the trick. You can't make a big do about it. You can't listen to them tell you that red wine will kill you, and you drink red wine and believe it and live long, thrive, and prosper. Okay? You got to leave what everybody else thinks about it out of it. If you crave white sugar, enjoy white sugar, and every spoonful of white sugar you bring into your body be only great, wonderful words for how delicious and fabulous and wonderful that sugar is. Okay? And then your body has no choice but to respond in kind. All right, now, as far as how your body's already regenerating. You don't have the same lips that you had when you were born. You don't have the same bum you have when you were born. You don't even have the same toenails that you had when you were an adolescent, okay? So it's a constant regeneration process. Allow your body to naturally replicate the joy, and only the joy that are the words that are coming out of your mouth. Love and appreciate your body. Speak often of how tactile and how wonderful your body moves. Speak often of how you feel well, that you have an inordinate sense of well-being. Then your mind says, okay, he's all screwed up. He's 109 years old, and he looks like Jack LaLanne. Oh, wait, that might be an example there now, mightn't it be? You come into a place where you allow your body to do what it's always been willing to do for you.
Sometimes your body not feel so fine, head hanging low most of the time. Got that meat sack not doing good, head hanging low, don't feel like you should. I talk to the Carolyn. What? Talk to the Carolyn. Talk to the Carolyn. What? Talk to the Carolyn.
Live with Dr. Carolyn Dean here on AchieveRadio.com, Hour 2, and we're so grateful to have you along talking to Da Carolyn, which we love that song so much. And we love Michael Brown in South Africa, who wrote it, an authentic, true South Afrikaner vibe, just laid out for Dr. Dean from his heart for all the things that she does do. And it does turn out and seems to be quite a popular theme that if you actually even just talk to Carolyn, you feel better. So we're so glad that Karen called in tonight. Karen, go ahead. You're on the line with Dr. Dean. You guys can wrap up your conversation, and then we'll move on. Welcome back.
Thank you. I guess the bottom line is, besides the formulas, is there anything else that you would recommend I should be taking at this point, or just, stick to the program and kind of, let things take its course?
Let's see what your doctor says to see if you're in an active state, because then that's where I would perhaps recommend the Natural Immunogenics Silver, their Sovereign Silver, as antiviral. But if you've got a doctor to work with, that's awesome. And that would be the only thing. It's like in our world, when yeast comes to the surface, then we go on the yeast diet and the probiotics, etc. And when viruses come to the fore, I go to the silver usually. So that's the main thing. And I don't know, how many months have you been on the formulas, Karen?
I have been on all the formulas with the exception of the RNA drops. I've been on everything since October of 2016, so 6, 7, 8, about 9 months. And then I started the RNA drops in January. So, and I feel like that has actually kind of gotten me through a lot of, what I've been that's been going on. I started the elimination diet probably like about 8 weeks ago now, 7, 8 weeks. And I think that's been very helpful with the yeast. I will say that I lost 10 pounds, and I don't really have 10 pounds to give. I'm not overweight by any stretch. So I didn't, maybe losing that weight, maybe I went a little too far, and maybe I should start to, try to beef up my caloric intake again somehow. But
good point. Yeah, it's like I know you don't sound like you're in menopause, but
oh no, I am.
Oh, you are. Oh, okay, because you need that extra bit of weight. So eat more fatty foods and maybe some grains. But again, just what your body is comfortable with and feels good with. But, you don't want to have weight loss. That's, again, with the infectious diseases, they do seem to affect people more when they're underweight. Interesting.
Right. And you did mention about fruit, just your comment before. I used to eat like 2 pieces of fruit a day. I don't know if you think that's excessive, but do you think it would be okay to introduce a little bit of fruit at this point, just to give me some of those antioxidants?
Yeah. The apples, pears, frozen berries seem to be the organic berries seem to be the best. But let customer service know how it goes with the blood testing and what your doctor decides to do with you. Okay.
Sure. Thank you so much.
Okay, Karen. Good. Thank you for calling. Good call.
Excellent. Yes, no question is stupid question. Every call is important and valuable because you're asking questions that all of our customers want to have the answers to. Believe me, I know. So please call in with your questions. Area code 970, we're going to go out to Colorado. Go ahead, please. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Okay, this is Starlin. Can you hear me?
Yes.
Hello? Okay, this is Starlin, and since there doesn't seem to be too many people calling in, I thought I'd do another one. I probably I try to avoid gluten and dairy. I've been a bad girl about the sugar, but at any rate, whenever I do have gluten or dairy, I take what's called a gluten flan. It's let's see, what's it called? I think it's an enzyme that helps dissolve the gluten, or helps to help digest the gluten, and then the lactase is a lactase enzyme to help dissolve the lactate, the inflammatory part. So, is that something I should take, or just forget about it? Are they good or are they not good?
I think it's a fairly, we've had lactase enzymes around for a long time. I don't know about this gluten enzyme. I'm afraid it sounds to me mainly like a marketing ploy to sell stuff, because they can't possibly.
Well, it's only available to medical people. You have to have a nurse, or it's an enzyme and a bioflavonoid dietary supplement by Apex Energetics. And I can't order it myself. I have a girlfriend who's a nurse, and she can order it for me. So that's why I thought maybe it was a little bit more legitimate than some of these other marketing ploys like you're talking about. But
well, I mean, since when are drug companies legitimate?
Yeah, right.
No, I'll have to look into it, Starlin. I don't know about this gluten flam, and I just think it's another, eat some crap and then take something to antidote the crap, whereas you could just not take the crap, until your body tells you if it's okay to eat a little stuff off the diet. But you just want to eat it every 3 days so that your body can deal with it and not build up allergic reactions. I personally, digestive enzymes don't even work with me. I just find that if I eat a little less, chew a little better, don't drink liquids with the meals, and that's the way to have good digestion.
Mm-hmm. Why don't you drink liquids with the meals?
It dilutes your stomach hydrochloric acid.
Oh, okay.
Yeah.
Okay.
Yeah, you could call customer service. There's a whole section in my Future Health Now encyclopedia about digestion, just to have some basics, even, putting a little apple cider vinegar in with water. Someone was asking that, and I didn't get to it, but a little apple cider in a couple of ounces of water, sipping that with a meal helps your digestion. I went off on the baking soda because I don't like altering your stomach pH like that in order to try.
Well, I was the one when I sent that or asked the question about the baking soda. I've also been using the apple cider vinegar. So could I still put the apple cider vinegar in with my quart of water when I'm doing the remag and yeah?
That's fine. That's perfectly fine. Yeah, but the baking soda, I don't think so. That's just it's like asking your stomach to work harder to digest your food, because you've made it alkaline.
I can understand that. They just told me to alkalize if you had osteoporosis, so that's why I did that. The doctors didn't say that. People said that.
I know. There's so much information out there. The main thing with osteoporosis is to get your remag balancing with the calcium in your diet. If you're But if you're not eating dairy products, then, you have to make your bone broth, eat your green leafies and nuts and seeds, or take a bit of Recalcia to get your 600 milligrams of calcium.
Okay. Thought of something else then. I just forgot it. But,
if you have questions when you're not, under the gun here of the show, just Google the question and my name, and often it'll come up. And then if that doesn't work, go to customer service. And if they don't have the answer, then they ask me. So you can always get your answers.
Okay. Right. So, but should I still take lactase enzyme when I do have a little bit of dairy?
I would do the lactase enzyme. I just don't know about the gluten, because I don't see how that can work on the crazy genetically modified, hyped up gluten that's out there now. I don't know how they can handle that in the sensitive person.
Mm-hmm.
Okay, we're good. We're good for now, Starlin?
Yes, thank you so much. It's nice to make your acquaintance.
Oh, sweet. Okay, hon. Thank you. Bye-bye.
Bye-bye.
Okay, excellent. We have another caller holding, but before we get to that person, let me do a couple of questions that have come in through the chat line and get this caught up, Carolyn. Okay, one question was, does magnesium remove arterial calcium plaque as well as EDTA or other chelation materials?
I do believe it does. We've had experiences. People have their ultrasounds before and after remag, carotid ultrasound showing that they're dissolving their carotid calcium plaque, and I think it works better in the long run. And I'd say it was remag that'll do it more than just any old magnesium. It will do better than EDTA because those chelating agents are drugs, and they will pull out more than calcium. They will pull out maybe too much calcium. When I did a couple of EDTA treatments on myself, my knees started to ache pretty quickly after 2 treatments. So it pulls out your minerals as well as heavy metals. So it's much, I think it's much safer to use the remag, do the realign with the glutathione precursor, and glutathione is your major heavy metal detoxifier. So
very good. Excellent.
Can I do a quick mailbag?
Yes, of course.
I missed this one. Can I please? Thank you. Hello. I can't wait to listen in on the show tonight, so I have to say this question. Could you please ask Dr. Dean to discuss how panic attacks lead to agoraphobia and how to treat if there are any additions to magnesium? Approximately a year ago, I tried to remite for this condition but found no relief. I take no prescriptions. I'm 50 years old, weigh 125 pounds, menopause naturally at 48, been taking magnesium malate and glycinate, try to eat potassium-rich foods, drink the Celtic sea salt water, take a pill for thyroid support, gives me a bit of energy, take Nordic cod liver oil, and a liver supplement. So I don't know how much remag and remite was taken and if it was just for a short time or if it was an extended time. But panic attacks lead to agoraphobia. Oftentimes it's if a panic attack occurs like in a closed space or a crowded closed space or going over a bridge or some outdoor event where the panic attack makes you feel that part of the panic is being caused by all the people or all the chaos or all the noise. So you feel safer inside. So, I mean, that's kind of a generalization, but, you know, sometimes people can have a low blood sugar attack, which pushes out their adrenaline and speeds up the heart rate and makes them feel panicky and sweaty. It's just low blood sugar, but they call it a panic attack because that's what it feels like. So then depending on the location, you can develop a fear of being in an elevator, fear of bridges, or then feel that the safety of your home is where you have to be. Agoraphobia means fear of the outdoors. I would just do the remite again and take it in therapeutic doses and keep in touch with us. If you told us back last year that, well, this isn't working, we would have helped you fine-tune. So that's what I would say at this point.
Okay, excellent.
Back
wonderful.
To you, Ginny.
Yes, okay. All right, so let's go to these questions. One from Alexis. My mom's cardiologist said she has to take cholesterol meds, Prevestatin, for the rest of her life because she's diabetic. I asked him if she changes her diet, gets off the diabetic meds, can she get off the Prevast, whatever that stuff is called? And he said no. Even if she's off diabetic meds, she would always have to take the cholesterol meds. Is this true? She says. Can magnesium help her in this situation?
Oh, my gosh. Yeah, this is part of the doctors believing that these very toxic drugs are used for prevention. If you get any one of these diseases, you're put on preventative amounts of the other drugs. So no, it's not true. Why they're saying that is because if you have diabetes and you're put on diabetic drugs, you'll develop more magnesium deficiency. Well, diabetes itself is a symptom of magnesium deficiency. It's in the medical books. Low, even serum magnesium is a sign of diabetes. So you're already low in magnesium, so you must take it if you're diabetic. And then the doctors see that you put on drugs, and a couple months later they do blood tests, and the cholesterol is starting to go up. So they think everybody who's a diabetic is going to get cholesterol, so we better prevent that, not knowing that they're causing it. So it's this terrible vicious circle. And there was a really interesting cholesterol question that came up. Someone said, here it is, yeah. I have thinning hair and high cholesterol. I'm on all of Dr. Dean's products. I started December 2016. I'm on therapeutic doses, 2 teaspoons each of Remite. I have low thyroid function and high cholesterol. I just did blood work for cholesterol, and it's still high. My last blood work was 3 months earlier. Total cholesterol is 302. So, yeah, they say 200 is what you should be. I say, 240 is fine. But her HDL is 118. Now, the average HDL is like 40 or 50. She's got whacking high, good cholesterol. And her LDL is 185, which is kind of high, but compared to the excellent HDL, it's not a problem. So I said to that part of the question, cholesterol is not the cause of heart disease. You can read the book, The Great Cholesterol Con by Malcolm Kendrick. See how the myth has been perpetuated, and even in the face of all studies showing that cholesterol is not the cause of heart disease. So this is for our chat line person as well. Doctors still perpetuate the myth about cholesterol. Also, the risk of heart disease is calculated as follows. So I took this person's 302 total cholesterol and divided her high HDL, or good cholesterol, into the total cholesterol. An optimal ratio is less than 3.5. Her ratio is 2.5. So she's actually in below average risk for heart disease with her cholesterol because she's got so much good stuff. And so I say to her, just because your total is high doesn't mean it's a problem. It's high because your HDL is extraordinarily high. Most people have HDL, I said there's 40 to 50. So personally, if I had your numbers, I would be perfectly happy. But arm yourself with more information by reading the Kendrick's book, The Great Cholesterol Con. As for thinning hair, just keep up on the Remite and Remac for building up your thyroid. It can take a span of time, but the body just needs the building blocks. And then she said her hair was thinning at the crown, and that can be a bit too high testosterone caused by too many carbs in the diet, which stimulates too much insulin, which makes more testosterone. So look to your diet and take restructure when you would otherwise eat a carb food. Also, massive stress can cause hair loss after the worst of the stress, and her husband went through surgery, so she had a natural shedding of hair 3 months after that huge stress. So that's a very good mailbag question. So back to the chat person. Do you think I answered that question in the midst of all that, Ginny?
Oh, yes, I think you did. And also, I think you answered it very well. And then the only other thing I would say to the person on the chat line is you can email us at support, SUPPORT, at rnareset.com, and we will help you complete that answer. If you know your mom's numbers, that we can have Dr. Dean work the numbers for you as well, because I'm sure that's the next thing that's coming. Okay. Linda, how do you make sure that you have enough potassium to balance with the sodium and the magnesium? How do you know when you need potassium? My husband seems to get low on potassium. His blood tests show low potassium from time to time. He has hypertension and Parkinson's.
Okay. Potassium, well, if he's got hypertension and Parkinson's, he's on drugs. I would imagine. So you can chat us back about that. And diuretics will lower potassium. And if you're on diuretics, you do have to get regular blood tests to check for your potassium. And then you either are taking potassium pills or eating all the green vegetables you can. You can make a potassium broth. I have the recipe for that in the Remite Recalcia book. So if he's on medications, then the potassium would be low. How do you know if you're low? You do blood tests if you're on drugs, and otherwise we do tell people to take enough of the green vegetables. Potassium is very high in vegetables. It's not farmed out like the magnesium is. But I think actually you should read the Remite book, and there's a whole section on potassium there that will be helpful.
Okay, Don typed in, Carolyn, a follow-up from last hour caller, chat line person, and said that the glutathione that she was speaking of that she's concerned about was not an IV glutathione. It was a teaspoon per day in a powder form.
Mm-hmm. Yeah, well, I don't know. I don't know what kind it is. Glutathione, it's metabolized so quickly in the liver that it would have to be a liposomal form of glutathione in order for it to get anywhere in the body. But, I would just say, if it's high-dose lab-grade glutathione, it just pushed her too much. And if you're taking the real line, we've never had anyone say that stirred them up in a detox way. Remag detoxes you more than the real line does. So, again, it's when you take the precursors, then you leave it up to your body to make the glutathione when it's needed.
Linda typed back, Carolyn, and she said that her husband with the blood pressure and Parkinson's issues is on a very low dose blood pressure medicine, 2.5 milligrams of amlodipine, and he's on not any Parkinson's meds.
Mm-hmm. Okay, amlodipine, I don't know.
AMLODI.
D-I-S-I-N?
No, P-I-N-E, AMLODIPINE.
Let's see what that is. So what was the question while I looked this up?
She was just asking how does she know, how does she know if her husband needs potassium, basically, and how to balance it with sodium and magnesium. How do you know he seems to get low because his blood tests are showing that he's low? Mm-hmm. So, are there symptoms of low potassium like magnesium? You get the leg cramps and stuff. Are there any symptoms?
Not, well, they say they are, but it's rare. It's usually just caused by drugs. So, again, it's in the Remite book. It is a big topic, but we don't worry about it as much as magnesium because if you're eating greens, then you're getting your potassium. So I guess that would be the next question to Linda. But amlodipine or dipin is a calcium channel blocker. Now, what's interesting there is I'll have to research that because I think I've read that do calcium channel blockers also block potassium? I mean, they don't act discreetly. So, and, she did say it was a low dose, but still, some people are sensitive. Yeah, there are potassium channel blockers that have come out of the calcium channel blocker research. So, that would be my question, is it blocking potassium? And I don't know the answer. It's just a question. So basically, feed them as greens.
Very good. Excellent. Okay. Now, let's go back here. The chat line is busy tonight. Carrie in New York. I started to take Remag about a year ago. Just about 3 weeks ago, I started to get very fatigued and started getting some anxiety again and weird tingling feeling in my body, especially in my mouth. And I'm wondering what it might be. Up to now, my blood pressure was in the normal range, but now I started to take 2 teaspoons of Remag a day. My blood pressure has skyrocketed, and I have this tingling feeling. Do you know what that could be from?
Well, I want a definition of skyrocketing blood pressure. Let's give me a number because that's scary to say skyrocketing. And I don't know. I mean, if you've just been on Remag and nothing else, then have you created an imbalance? Are you on the sea salted water? Are you on your Remite? Do you need calcium? Are you on Recalcia? Have you had dental work lately? Have you taken a vaccine? What's New York doing to you? It's so toxic. So there's got to be something going on that's triggered this. But the first thing is, are you taking all your other minerals?
Okay, very good. Excellent. Okay, so you've got your homework now, Carrie in New York, to get all those questions answered. And if you don't get them to me on the chat line, please, as a matter of fact, you probably should just send them to support, SUPPORT@RNAreset.com, and let me send this to Dr. Dean so we can open a ticket and start a regular conversation so we can help you sort out what's going on and get you on the right track. Okay. Very good. Now, let's see. I'm craning through, making sure that we're all kind of up. Linda from Ontario. I just had 3 stents put in 3 weeks ago. I heard magnesium would be helpful for my heart. What are your thoughts?
Well, yes. I've written thousands of words about the importance of magnesium for the heart. So the stents, that means you're on a blood thinner, you're probably on other medications, and that's going to drain your magnesium. And the cause of heart disease in the first place can often be magnesium deficiency. So, I'm not just going to say, take magnesium, you'll be fine. You have to read about it, read my Remag book. If there's any arrhythmia, read the atrial fibrillation book. Just do your homework and understand what magnesium does for the body. And then use the Remag if you want a therapeutic magnesium. It's important to use Remag. And we never tell people to come off their meds, but you may find as things improve, you don't need all the meds they've been giving you. With stents, though, they've got this foreign body in your arteries, so they demand a blood thinner, and I can't tell you not to do that because a foreign body in your blood vessels can have the tendency to cause blood clots. So that's a real problem with the stents these days, is they demand a blood thinner.
Very good. Last question, and then we're going to go to our caller, Mr. North Carolina. I see you, and I know you're there. Oh, wait, he's not there anymore, but he will be back. I know him. He will come back because Roman was holding, but he'll get back to us, Carolyn. Okay, let's go to this question here with, Elise. Help. I've been diagnosed with POTS, P-O-T-S, which is postural orthostatic tachycardia syndrome for those who are listening, and it is so debilitating. I'm on midodrine, midodrine, use lots of salt, drink a lot, but I want my life back. Would the medication to increase blood pressure also reduce magnesium?
Well, the reason why people get this orthostatic hypotension can be caused by magnesium deficiency. What the midodrine does is it tightens up the blood vessels to keep the pressure up in the blood vessels. So I have an entry that I read when I come across POTS. Postural orthostatic tachycardia syndrome is defined by excessive heart rate and also low blood pressure. Magnesium deficiency can cause an underactive autonomic nervous system, leading to low blood pressure and poor circulatory system performance. Some people think magnesium will lower their blood pressure further, but slowly increasing magnesium will actually treat the underlying autonomic nervous system problem and improve the blood pressure. So what personally I would do is start taking Remag, the quarter teaspoon in sea salted water. They're giving salt to raise the blood pressure, but it's not the salt. It's not the sodium. It's the magnesium that's deficient. So yes, start with the Remag, read the Remag book, and get an idea of what we're talking about here, and then start it and keep in touch with us. You probably need the other minerals. We don't know your whole story yet, but read the Remag book and see if it makes sense to you.
Okay, very good. Excellent. 602-666-6027 is the number to call. If you want to talk to Dr. Dean tonight, you've got to hit *5 on your keypad to let us know that you've got a question or comment, and we will put you on the line with her, and you will be able to talk with her this evening. So let's go to our next phone caller, which is in Haymarket, Virginia. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hi, my name is Christine Hoke, and so I'm 51 years old. I have been diagnosed with hypothyroidism, and I'm most concerned about the fact that my hair is drastically thinning and I have a bald spot, something I guess similar to what you talked about earlier, but I also burp a lot after meals, and my ankles tend to get swollen later in the day. And I know I have yeast issues because my tongue is white in the morning. And so I've been on the Remag since November. Right now I'm at 3 teaspoons a day, 2 teaspoons of Remite, half a teaspoon of Recalcia, and then the 2 Realign, and then some of the sample RNA drops. I try to reduce the Armor down to 1 per day, but I felt really tired. So I'm back to the 2. And I've heard about the purge drink, so I'm interested in doing that, although I drink the Podokar tea. And so I just really want to see what your thoughts are about my hair and the bald spot. And there's a little bit of sometimes I get, scrapes or little bits of skin come off where the balding is. It's white. It's almost so. I don't know if that's maybe yeast coming up. I don't know, but anyway, I'm just curious your thoughts.
Okay. I get distracted at the beginning. What's your first name?
Christine.
Christine. And how old are you?
51.
Okay. And how long has your hair been thinning?
I'd say like 2 years, but now it's just getting really bad.
And when did you start the thyroid medication?
Probably at least 2 years.
Around the same time?
Not exactly. A little bit. I'd say the thinning happened before I went on the medication. I also take progesterone. If that it's the natural form for progesterone. I do take that as well.
Okay. Gosh, the bald spot. Do you have seborrheic dermatitis? Do you know that condition?
Don't know.
It's like
I don't have. Go ahead.
It's like thick dandruff of the scalp.
No, I don't think so, because it's only the shedding of my skin is only in that one area. And I've been to I've been to a regular my primary care physician who did some scraping and sent it in, and whatever they can normally do in the primary care office, she wanted to send me to a dermatologist, which I'm reluctant, because when I went to a dermatologist before, they wanted to put me on like some kind of cancer medication. I just don't want to. I wanted to know what you had to say about it.
Well, did you have the scrapings analyzed? What did they find?
All I know is that the primary care physician cannot treat it. They didn't get enough information, so that's why she sent me to a specialist.
I don't know. Not being able to see it or scrape it or test it myself, I can't. I really wouldn't be able to say what it is.
How about the swollen ankles? Okay.
Swollen ankles. Are you doing your sea salt in water?
And I exercise a lot. I'm a very healthy person. I mean, in terms of what I eat, I don't eat carbs. I eat very little, hardly any sugar, unless it's in fruit, and only like 1 or 2 pieces, less than that a day.
Right.
A gluten-free, casein-free diet.
Right. Yeah, it doesn't seem right. It doesn't seem right. Do you have varicose veins?
Yes. Yeah. I mean, not terrible, like spider veins. Kind of runs in my family.
Yeah. Do swollen ankles run in your family?
Not really. No.
Yeah, because it's...
And it's not every day. Like, it's not the weekend. It tends to be when I'm in the office. I have a very long commute, 2 hours in the morning, 2 hours in the evening.
Oh, my gosh. And you're sitting the whole time or standing?
Yeah, of
or
course.
Driving?
Sitting. Oh, no, actually I'm sitting. Sorry, I'm on a bus. Sitting.
Well, that could do it, Christine, because when you're sitting with your legs at knees at 90-degree angles, you're cutting off your venous return and your lymph return and everything. If there's a way
standing?
You can, well, either alternating or take a bag that you can put your feet up on. It's it's heaven forbid. It's like these people who fly all the time and they get swollen legs and I'd say that was the reason.
So maybe during the day when I'm at work I could stand more, and I can't do that on the bus. There's too many people, but I probably could stand. I have the ability to stand at my desk more.
Right. Wow. Any chance of getting another job or a job at home?
Actually, 2 days a week I do. 2 days a week I work at home, but on the days when I go in, I definitely see it more. But I also exercise on the days when I'm at home. So.
Yeah. Well, I'd say, That's what's doing it. I mean, it's just anatomical. Nothing else makes sense. You're doing everything else perfectly.
Mm-hmm. Okay.
And, the bald spot, I mean, could you have got bitten up there? You know, could it be a bug bite?
Possible. But no, I mean, it's bigger than that by far.
Oh, okay.
My hair covers it up. I comb over it, but I'm just, it's not getting better. And it's been, like I said, it's been years. And also, I am concerned about the burping after meals, too, so.
Well, that, you'd look at yeast and, doing apple cider vinegar, sipping a bit of that in water. And I would go to the specialist. You have to use these specialists for their ability to give you a diagnosis. And from there, you can do what you want to do. But, you can't operate in the dark.
Okay. That's helpful.
Okay. But let us know, okay?
Yeah, and I'm probably going to email because I want to know the exact specifications of that purge drink, so I will do that.
Oh, right. Okay, good. Okay, Christine.
Thank you.
You're welcome.
Bye-bye.
Bye-bye.
Excellent. Live with Dr. Carolyn Dean here on AchieveRadio.com. Glad you're with us this evening. 602-666-6027 is the number to call if you want to talk with Dr. Dean tonight. You've got to hit *5 on your keypad to let me know that you have a question or comment, and I will put you on the line with Dr. Dean. And let's go to area code 952, Twin Cities, Minnesota. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
My name is Mary, and I'm interested in knowing, I do not yet take Remag. I have a magnesium supplement, but I can't afford the Remag at this point in time. I'm not able to buy it, but I'm wondering about its benefits for, like, pituitary tumors, particularly a non-secreting pituitary macroadenoma that with a possible stalk effect that might be apt in the future to affect the pituitary function.
Well, we don't say magnesium treats cancer. I mean, especially something specific like that. So, I've never seen any studies about pituitary tumors and magnesium.
But probably it would be helpful for,
Well, it's helpful for hundreds and, maybe thousands of body interactions. It's exceedingly helpful. I'm just looking up my new edition. I do start including some cancer studies, but it's mainly gastrointestinal where the magnesium is helping to detox the bowel rather than being an anti-cancer nutrient. But yeah, it's you can read my Remag book and understand more about what magnesium does. And in terms of the cost, Ginny can send you a little FAQ that we have about Remag compared with others, because when you look at it being 100% absorbed, then compared to any other magnesiums are anywhere from 4 to 20% absorbed, then you're just you're buying a magnesium maybe for 2/3 of the price, but you're only getting a quarter of the amount as you would get with Remag. So that's the way we look at our Remag being so effectively affordable.
Sounds great.
Yeah, sorry I can't help you with the pituitary tumor, but thanks for calling in.
Thank you for your time.
Okay.
Bye-bye.
Bye-bye.
All right, very good. Live with Dr. Carolyn Dean here on AchieveRadio.com. Yes, that's what I tell everybody. They're like, well, will it help with this? Will it help with that? And it's like, well, even if it doesn't help with that, how about the rest of your entire body? So, excellent. Okay, Carolyn, I think we're caught up on our phone calls, and I'm thinking we're caught up on our Chitty Chat line. If anybody raises their hand, star 5, and wants to talk to you, I will put them on the phone with you. But right now, we are all caught up, and we are caught up on our chat line and all of our inquiries and questions. So we're doing good.
Okay, then let me do the mailbag.
Okay, very good.
We have someone asking about bipolar, and she says, I'm curious to find out if bipolar disorder is linked to a magnesium deficiency. Could you send me a link of any of your findings? I'm guilty of purchasing your Remag and not using it. It's probably expired now. So time to order more. No, it really never expires. We have to put a date on it, but it's being a solid mineral or a stabilized ionic mineral. It doesn't really expire. As foster parents, should we ask our doctor or notify case managers that we're using this supplement? Oh, they're foster parents. We have well water, but I still use an over-the-counter filter. I didn't know if this was like medication where you're supposed to report it. Thank you for your insight. So I'll have to email this person. I don't know if she's listening, but magnesium is a food. But I know I've been in the situation of parents wanting their kid in boarding school to use Remag, and they had to get a note from their doctor and all manner of stuff. So I don't know what this world is coming to. And I really couldn't say. You'd have to ask the case manager if you're allowed to give the kid a magnesium. It sounds absurd, doesn't it, Ginny? What is the world coming to? And another question. My mother recently has had multiple occurrences of mini strokes due to AFib. She went from taking no drugs other than Tums for her chronic stomach upset GERD issues to taking several drugs for blood pressure, blood thinners, AFib meds, cholesterol meds, antidepressant, anti-anxiety meds as well. Now, the Tums is being a calcium carbonate. That could have gotten her into the problem in the first place, all that calcium blocking out her magnesium. And then the writer says, plus she is on a magnesium supplement prescribed by the doctor because of some of the meds she's taking. It's probably prescribing it for her constipation, probably a mag oxide. On her own, she has added probiotic and fish oil. This person who's writing is taking a transdermal magnesium. Her mother's been complaining of arthritic-type joint pains, wondering if the transdermal would help, not sure if it'll clash with the magnesium pill she's taking, also wondering if the magnesium could replace her serotonin reuptake inhibitor, Lexapro. Love to find as many alternatives to these drugs as I can. Yeah, it's interesting. These last two questions from people who really, they don't even know what magnesium is in a sense. You really have to go to the Remag book or the Magnesium Miracle book and really educate yourself about magnesium. This is not a drug where I'm going to say, yes, take this drug, take Remag the drug, and you don't have to take these other drugs. It's not like that. And yeah, it is interesting the way it's a standard protocol. If someone has AFib, then they're going to be on blood pressure meds, blood thinners, AFib meds, cholesterol meds. And then since they're so upset, they're on antidepressants and anti-anxiety meds. So frustrating. But we're almost at the end of the show. I will hold on until then, and then I'll scream. This is a Facebook question, which was another scary question. This person, probably a customer of ours, says, I was on a Facebook page promoting Dr. Dean's products to people suffering from magnesium deficiency, and a hair analysis doctor told me this. He or she said, it is impossible to simply take magnesium and allegedly replenish its stores. And it is stores, can't even spell right, replenish, IT''S, stores, or even raise magnesium RBC for that matter. Impossible means that not a single person on the planet has done it or will ever do it, just as it is impossible for something to exist and not exist. I mean, it's impossible to replace your magnesium stores. Mother Nature has her rules on how minerals must behave. Man can never override these rules. This is not something we can choose to agree or disagree with. It is what it is, just like we can't choose to agree or disagree that the moon exists. It's not a matter of personal, subjective, opinionated agreement. It's a matter of fact. And then our writer says to us, I wanted to see what you guys had to say about this. I'm taking Remag myself, but obviously don't want to do anything wrong. So right away, the fear basis comes to the fore. He also said taking magnesium over time will drain all other minerals and that the RBC will raise, but then it will eventually drop. I'd like to combat this argument because I believe in these products. Thank you. So, yeah, I just said this is unbelievable that a so-called practitioner can be saying that you can't raise your magnesium levels. I mean, all you have to do is listen to this show or read the testimonials or talk to me about taking magnesium to the point where you don't have to take your drugs anymore, having blood tests improve over time. And what I said in answer was that it seems this person is looking at serum magnesium as something that doesn't shift. And serum magnesium doesn't shift because as soon as it starts to drop a little bit, it pulls magnesium out of the magnesium stores in the muscles and the bones in order to keep the levels up in the body. I mean, it's just the way Mother Nature really works. So, yeah, this was pretty crazy. And actually, I wrote the answer back to Ginny, and I wondered, Ginny, did you hear back what this woman thought about it or what she did with the answer I gave her?
She loved the answer, and she said she was going to be posting it everywhere to everyone and that she would let me know, and she hasn't gotten back to me yet. So I can follow up with her and ask her if she did post it and what the responses were.
Right. And I think this is the last mailbag. I'll try to shorten it. It's been about 50 days, no AFib attacks, and in the last week or so, no irregular heartbeat showing on my blood pressure monitor. I used to get 50% of the readings with a regular rhythm. Now it's 100% in rhythm. So far as I'm concerned, my AFib problem is a thing of the past. I continue to take Remag and Remite. And then she wants to focus on her thyroid. She has autoimmune thyroid disease. That would be Hashimoto's. Her anti-thyroglobulin antibodies are down about 50 or 60 points. She says her thyroid is jumping around a little bit. The endocrinologist said it would finally burn out and never come back. And I said, it's amazing how these doctors become psychic. I said, how can a doctor know what you and your body are capable of? And she said she's feeling so good that she's not going to listen to that argument from her doctor. So I told her that she probably needed more Remite and could up the Remag, and I said to also look at yeast overgrowth because thyroiditis seems to react to gluten and sugars, and a yeast-free diet would help her. Now, she did say that her yeast questionnaire, she had a low reading, but I think it's still useful for her to go off sugar, gluten, and dairy to see if her thyroid will settle down even more. So that's my mailbag. I don't believe I think this is the first time we completed our mailbag in years, Ginny. So
well, we have another question that I skipped on the chat line, and then we've got a caller holding that maybe we can get to if we get this question answered. And the next question was Carolyn this is from Alexis, and she typed in, oh dear, I just lost it again. Sorry, Alexis. I am very sorry about that. It seems that the thing keeps eluding me here. She wants to know if she can do the total body reset, and she can also do the yeast protocol if she's taking other supplements that include a homeopathic called Cancordistat.
Cancordistat. Well, if it's a homeopathic, it's compatible. I don't know the Cancordistat though, but I do tell people that homeopathic candida remedies can be helpful, so I'm sure it's okay.
Okay, very good. And then let's try to get to Sandy. Sandy, we've got 58 seconds. Shoot.
Oh, hi. I'll give you a quick answer, a question. Epicord is, of course, a fermented yeast product that is you can buy in the health food store, and it's shrouded with health benefits. And, of course, beta gluten, I think that's the same type of thing based on a yeast product. But even having as far as to help people with cancer, they shroud this with. It balances the immune system, they say. My question is, how do you feel about somebody taking it? Can that give you too much yeast? I mean, you're talking a lot about yeast overgrowth. Is something
It's Saccharomyces cerevisiae, so it's not the Candida yeast, and that it's Saccharomyces that the Grown by Nature grows its nutrients in. So it should be okay, but I really haven't looked at it. So I'd have to test it. I'd have to check it out. And good night, Sandy. Good night, Bob. Thank you.
Goodbye, everybody.
Jenny, goodbye.
Goodbye, everybody. Bye. Thank you. Good night, Bob. Thanks, everybody.
Good work. Good
Great
job.
show. Thank you. Thanks, Bob.
You're welcome.
Creating physicality that has access to non-physical. And everyone has that inside them. That's how the coroner can tell if you're deceased or not.
And Marilyn Monroe couldn't stay on planet Earth, and there aren't been any good sexy role models since then, so I'll just have to pick with what's left.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.